I don't think people are actually taught how to use condoms. There's a teat at the top, and you're supposed to actually press up the air before you put it on.
Oh.
Because what happens...
Hey, you've been using it incorrectly. Why is that all so loud? And that's how they fight. You know what? My condom, you want me to take pill?
Welcome to Bloom&Banter.
Welcome to our podcast, Bloom&Banter, where we raise awareness and also navigate complex topics about female sexual health, empowerment, and mindfulness. My name is Crystal, and joining me today is my co-host, David.
Hello guys, my name is David, and together we want to break down stigma, share love, most importantly share a diverse view of topics that we don't usually talk much at home. It's time to bloom together.
One banter at a time. Today's episode is a really interesting one. We're diving into the world of birth control. Does it actually work? What types of birth control are available in the Malaysian market? Ladies, we're going on a shopping spree today. We're going to be choosing out of the birth controls which one we're going to be putting it into our cart. And most importantly, how do these birth control methods actually affect us physically and emotionally? We will also be touching on the role of men, you, in birth control discussions and decisions, as it is a shared responsibility. We will also be sharing about the accessibility of birth controls in Malaysia.
And today we have a very special guest from Sunway Damansara, ONG Dr. Loh Huey Wen. Welcome.
Hi, Dr.
Hi there.
Thanks for joining us today.
Hi.
Could you just do a brief introduction about yourself to our viewers?
Hi there. Dr. Loh, commonly known as Dr. Wen actually. I'm currently working in Sunway Damansara. I work as an obstetrician, so that means that I deliver babies. Gynecologist, so I deal with all other women problems, and fertility, so I help people who want to get pregnant.
So doctor, what are some of the challenges that you face, right, when you discuss birth control options with your patients?
So birth control is something that, that we prescribe very regularly for more than one reason. It's not just for birth control. We can use it to control your periods. We can use it to control things like skin conditions like acne. We can use it to actually help with moods, sort of like PMS as well. So it's actually used for more than just birth control. However, I do find that there are a lot of misconceptions around birth control. There's a lot of fear about hormones. Which what I find quite amusing is people are willing to take all the supplements under the sun. Supplements where, there are, that's not necessarily research that shows it works, but they're afraid of taking birth control hormones. And I think that we need to actually dispel the myth, if used correctly.
Okay, so actually birth control is not just to control birth itself, right? Because you mentioned also for PMS, for acne problems and all of that. So aside from birth, I am assuming that you are talking about birth control pills, right? What other birth control methods which you actually,
So there are different types of birth control, and birth control will depend, the type of birth control you use will depend on each individual's needs, your plans for fertility. So certain methods last longer than others. And obviously what is acceptable to you. So I find that because there's so many different types out there that I normally tell them, these are your options, and then I let them pick and choose. Okay, so we start with barrier. So the barrier is the one that everyone knows about, condoms. Okay, so condoms are easily accessible now. Kudos to all the for all the shops for keeping the condoms near the chewing gum. So sometimes people accidentally buy condoms instead of chewing gum.
Or they buy it together.
Right?
Just to
or they just put it together, which is fine. Whatever. So that condoms is a very good form of birth control. It's one of the first few birth controls out there that can protect you against sexually transmitted infections. It's probably the only one that can protect you against sexually transmitted infections. And condoms, if used correctly, actually are very effective. Okay, so then we have the hormonal ones. So hormonal ones can come in the form of tablets, which is everyone knows as the birth control pill. It can come in the form of injectables, which can have you can get every 3 months, once every 3 months. And then you have the longer acting ones, for example, the IUD, which is a device that you put inside the uterus, and also the implant, which can last longer, so about 3 years.
So you mentioned about hormones quite a few times, right? Do they all target the same hormones in your body?
Okay, so majority of the birth control out there either have estrogen or estrogen and progesterone, and some of them have progesterone. So it's either one of these hormones, okay? So they work in different ways. The estrogen that we put into your body, that you take in your pill, in the oral contraceptive pill, actually is a very low dose, which just fools your brain. Now, normally what happens is that your ovaries have two jobs. One job is to produce eggs, and one job is to produce hormones. And it all relies on the signal from the brain. Okay, that's why when you're stressed, your periods go a bit crazy. Yes, because your brain is very stressed, so not sending the correct signals down to your ovaries. Now, what birth control pills do is that we give you a small amount of this hormone so that your brain thinks that there's enough of this hormone, so it stops sending signals down to your ovaries. No signal from the brain means that your ovaries don't produce eggs, and because they don't produce eggs, you can't get pregnant. Okay, so that's why we give combined, and why we have to give both is because we can't give estrogen alone. Is because estrogen will thicken the lining inside your uterus, but the progesterone will balance it out. So we give it together normally.
Personally, I've only heard bad things about
Really?
birth control pills. Yeah.
So what have you heard? Tell me.
Weight gain,
Okay.
mood swings. I'm really crazy. I'm gonna go crazier. So that's a big no. And then if you miss like a day, it's like just not as effective as it is. And I'm a very forgetful person, so it's putting a lot of stress. So my period's gonna be late. Like it's just too much going on. So that's why I think there are other methods that perhaps, doctor, right, you can also share. Maybe let's just start off with condoms first, right?
The problem is I don't think people are actually taught how to use condoms. I don't know whether you learned it
In our school, no, actually we don't.
Never.
So nobody taught you, right? They just give you, you're just expected to sort of grow up, have sex, and then later on you work out how to use condoms. I think that's the difficulty. So you're actually supposed to there's a teat at the top, and you're supposed to actually press out the air before you put it on.
Oh.
Because what happens?
Hey, you've been using it incorrectly. Why is that so loud? Oh.
So you're supposed to actually remove the air so that there's space for the semen to be caught, to accumulate in there. That's number one. Number two, getting proper condoms and not some, because you want to make sure that you get good grade condoms. So the last thing you need is for them to split. Okay,
Or break.
or have leakage, and so I do encourage men, especially after they've used the condom, to actually, once they take it off, to check for leakages. And lastly, obviously, a lot of people do this. So what they do is they have intercourse. They start first with the penetration, and then they only put on the condom later.
That even kills the mood more, isn't it?
It does, and people think it's safe, but actually what happens is that what men don't realize is there's something called pre-ejaculate. So before they actually ejaculate sometimes, small amounts of semen can leak out, and it just takes one sperm to do the job. So there's always a risk of pregnancy, despite the fact that, so that's why some people say, I used a condom, but I got pregnant. So then you need to work out what their technique was as well. When did they use the condom?
So you mentioned about pre-ejaculation, which is I think called pre-cum also, right? So is the percentage of sperm count lower in pre-cums?
Well, the concentration is per mil. So if you think about it, we have the normal sperm count is at least 16 million per mil.
It's like an army of samples
So if you
swimming.
think about it, even if it's half a mil, it's still a significant number. So that's what we mean by correct usage.
But I also heard that there are some guys where they actually use it as a double protection. So they put it on one, and then they use it another one to actually.
Like double condom?
Yeah.
So I think there are some people who think that if you double, it's like double gloving, like how we double glove before we operate. Actually, to be honest, I don't actually think that condoms are made for you to wear two at the same time. Number one, there's a higher risk of slipping, okay? And it also depends on the kind of lubricant. You may actually cause small tears and give you a false sense of security. So I think get good quality condoms, okay? So no buy one get two free type, okay? Okay, and make sure that if you're going to use condoms, I think one should suffice, actually.
So doctor, what kind of lubricants are out there as well? If you could just
So there's so many types of lubricants. I'm sure that you've seen them all. The most important type of lubricant that you use, it has to be water-based, okay? So oil-based lubricants can actually erode the rubber. And if it erodes the rubber, then your condoms don't work
So don't
anymore.
pair oil lubricants with
Yes.
latex
Yeah.
condoms.
So no olive oil, nothing like that, Just use the water-based. So some people they feel that using massage oils,
So it doesn't work.
It's not that it doesn't work. That there is a risk that these massage oils will erode the actual rubber and makes the condom less effective. So water-based.
Water-based.
Okay, so just only water-based and latex condoms,
Yeah.
not the buy one free one ones.
Yeah,
All
try
right, we got it. All right. Asking on behalf of my ladies, should we trust it as a sole method of birth control? Should we pair it up with something else?
So a lot of them, sometimes some women I know they will start themselves on the oral contraceptive pill. So that they find that will sort of prevent ovulation, plus the condom protects them against sexually transmitted infections. So that helps sometimes. But it's entirely up to the patient as well.
So now let's talk about birth control pills.
Okay.
This is something that I am really interested to know more about. How you mentioned roughly how it works, and we know that it prevents ovulation.
Yes.
But what happens to our bodies?
So when you think about pills, right, you must remember the oral contraceptive pill, you need to take it every single day. That shows you that the hormone levels only last around 24 hours in your body, roughly, okay? Because your liver breaks it down, okay? So what happens is that if you think about it that way, the fact that you have to replenish the hormones every day, it means that the amount of hormones that we pump into your body is actually quite low, okay? The effect actually, to be honest, the pill, if you find the right one, so you have to find the right preparation. There are certain preparations that agree better with some than others. And it's because of the different dosage of the estrogen. It also depends on the type of progesterone. So the progesterone can be derived from different things. So certain ones are actually better than others. Okay?
It's like brands?
Well, it's not really the brand, it's just the makeup of the pill itself. So for example, some people, they find that when they take a certain preparation, their PMS gets worse. Okay, so their PMS will be symptoms like breast tenderness, mood swings, bloating. And in some patients, PMS can be really severe. The ones who have very severe PMS, actually, they can't get out of bed sometimes. They can't go to work. And they're a nightmare to work with during that time. So we do have some preparations that can actually reduce these symptoms. And we actually use it to treat PMS.
Why would this actually trigger our mood swings as well? So like just within our body itself, what is happening? Okay. Why are we so triggered?
So once you ovulate, then certain hormone, progesterone, is actually very high in our bodies, okay? Progesterone is necessary because this is the hormone that matures your lining, makes your lining gets it ready for implantation, for pregnancy to take place, okay? Unfortunately, it also causes the mood swings, it causes the breast tenderness, it can cause bloating, and it can cause these cravings that you get before you actually, that you get before your period. So that's what PMS mainly is.
So progesterone is no good.
It's not that it's no good, but progesterone is the culprit.
Do we like her or not? Are we standing her?
Well, we need her. We do need her, but she's not really great for us before our periods. Now, we all respond to progesterone in a different way. So, for example, my PMS symptoms will be different from yours. Okay? So, in some patients, in some people, they find that when they take progesterone, their symptoms, are actually minimal. But then I have some as well that, they find that they get very moody. For example, on certain preparations of the pill, they get very moody, they get very depressed, they get breast tenderness. So the best way to deal with that is to actually change the preparation.
Okay, so imagine me going to like a pharmacy.
Yes.
All right, what questions should I ask the pharmacist? Given that there are so many options to choose, just now you mentioned like the concoction, the different types, right? So what easy way for me to answer questions that I can get easy answers as well?
So normally the pharmacist will ask you whether you've got any medical problems, okay? Because obviously if you have certain medical conditions, the pill might not be suitable for you, all right? They will ask if you have any allergies, because obviously allergies are important. If you're allergic to certain medications, the pill might not be suitable for you. And then based on that, they will also ask you, for example, what your fertility wishes are as well. Okay, so that's why I always ask my patients, when do you see yourself getting pregnant? Because certain preparations will last longer than others. So the pill in general only lasts for the time that you're taking it. As soon as you stop taking the pill, your fertility comes back. Okay,
Even for a day, if I miss it?
So let's say, okay, we'll come back to the missed pills.
I'm like so scared now.
So it's not so bad actually. So once let's say you take the pill for a couple of months and then you decide you want to get pregnant, you stop it, your fertility comes back. Immediately. So actually, what we are always worried about is that it's going to have a long-term effect on your fertility. It's going to have a long-term effect on your kidneys and your liver and everything. Actually, the effect is actually minimal. Unless you've got underlying liver disease or something like that, the effect is actually minimal.
Speaking about birth control pills, there are also a few types, right? If I remember correctly, there are combination pills and also there are mini pills. So maybe doctor, you want to actually tell us what's the main difference?
So I talked about the normal combined oral contraceptive pill, which has got 2 hormones. There is something called the mini pill, you're correct?
Mini, M-I?
Mini, yeah, they call it the mini pill because it only contains 1 hormone, and that's progesterone.
We hate it. Okay, but tell us more about mini pill.
So the progesterone pill is, some people like it because they find that it's, they actually find that, they have taking less hormones. It's good when you're breastfeeding. So if you're breastfeeding, so that is actually very good for breastfeeding mums, okay? The only thing about the mini pill is that I find that the window period at which you can take the pill is a bit shorter, okay? So the window period meaning that, okay, so when it comes to the pill, some people go, I will take it every single day at the same time. You try to take it around the same time, but you actually have got some time to play around with, you see. So you do have, about 24 hours. If let's say you forget, you take the next day, it's still, the effect is still there on your body. You're still protected, okay? So missing 1 pill is actually not an issue. It's when you miss more than 1.
How about 2? Let's push it.
Yeah, if you miss 2, it depends on where you miss it in your cycle. So if you miss it sort of, very close, it's sort of, in the beginning part of your cycle, then obviously you're still protected. But if you miss it very close to the ovulation time, there's always a risk that you may suddenly ovulate. See, so that's the only thing. So it depends on the timing of the cycle. And normally we'll just tell you to take the pill, what's remaining, and then continue as usual, and maybe use alternative contraception.
Could you also just maybe share a little bit more about what a period cycle is to our viewers? So there are 28 days, and then just now you said it's like if it's closer to,
So basically, first day of your period is what we would consider kosong kosong, the start of a new cycle, okay? Everyone's cycles will differ. So there's some people, the traditional cycle is roughly about 28 days, okay, which is why you get a period every month. There are some patients that have longer cycles. So some patients will have cycles, can go up to 35 days sometimes. And then they get stressed because their period doesn't happen at the same time every month, okay, because your 1 month is 30 days. So what happens is that in the first part of your cycle, which is halfway through, is that the lining gets thicker and thicker. So if you think about the lining as soil. I always tell my patients it's like soil. You want to make sure that there's adequate soil for your seed to be planted, okay? And what happens is that ovulation will tend to take place in the middle of your cycle. In your ovaries, you will recruit a certain number of eggs, okay? And these eggs will grow together, and it's a race. So the one that gets the biggest, fastest is the one...
It's a competition.
It is, definitely, because we want the best egg to be released. So the one that gets the biggest, fastest is the one that releases the egg. Now, once the egg is released, then what happens is the progesterone comes in, okay? Your friend progesterone.
She's here. What's she going to do?
So what she does is she makes the lining much more vascular, so more blood vessels grow. It's like fertilizer. So before you plant a seed, you want to make sure that the soil is fertile. So that's what progesterone does. And basically, if implantation takes place, then that's great, you're pregnant. If implantation doesn't take place, then what happens is that lining actually just sort of gets, what would you call it would just get thrown out. And
that's what you call period.
Yeah, that's why you have a period.
So if I'm getting this right, the 14th day is like the most fertile day.
So it depends on your cycle again, okay? So it's about day 12 normally, roughly around there. 12 to 14, sorry. So it depends on you as well. Okay, so I always tell patients we're not robots. So it's not like day 12, we press button, ovulate today. I wish it was that easy. It doesn't work that way. So what normally happens, it depends on how stressed you are, whether there's anything else going on in your life. Sometimes your ovulation might, sort of be plus or minus 1 or 2 days sometimes.
So another thing that I would like to ask about is weight gain.
So the pill doesn't actually make you put on weight, okay? There is a slight amount of water retention that sometimes happens when you're on the pill. So you might you might sort of, put on about a kilo or two, but normally that goes away when you have your period. However, people who put on weight normally, it's because they've given in to the cravings that is caused by misprogesterone.
So it's still misprogesterone, like at the end of the
So
day.
misprogesterone can sometimes cause you to have those cravings that you get before your period. And if you give in to them and you eat chocolate cake every day, you are going to put on weight.
I see. So it's not like a direct
It's not a
attribution,
direct, yeah.
right?
So we do use it for a lot of things, but obviously we would advise you only to go to your pharmacist or to buy it if you're planning to use it for birth control. If you're planning to use it for any other reason, best to get it checked first with the gynecologist.
So, okay, let's move on to the morning after pill, or we call it as the emergency contraception, right? How does it work? How is it different from birth?
regular.
So
regular birth
it
control?
contains high levels of misprogesterone, okay?
Oh, okay, I already
So
don't like
she's
this.
useful. There's two types actually of the morning after pill. One of them contains high levels of progesterone. The other one actually is a completely different medication. And basically what they aim to do is to try and aim to delay ovulation. So if you take it before you've ovulated, so technically it should delay your ovulation so that by the time you ovulate, hopefully
egg
there's
doesn't
no
come
sperm
out.
left inside.
Oh, so it's like asking the factory, like, stop
Stop
for a while, pause.
Stop for a while, yes. So you just tell them to just pause it. So the morning after pill actually shouldn't be used as routine. It's actually called emergency contraception for a reason. So patients who, let's say the condom has split, or maybe last night, you had sex and you completely forgot about the condom. Yeah. Then yes, that's something that you can consider. However, if you are using it very regularly, I would recommend that it might be better for you to be on the oral contraceptive pill instead.
Speaking about like morning after pill, like what is the maximum amount that you can use in a month? I think this is quite a frequent question,
yeah.
right?
Normally, we don't recommend that you use it more than twice. The levonorgestrel one, you can use it more than once. The other one, actually, it's not recommended for you to repeat it. I think if you need to use it more than twice, you need to go and see a gynecologist now and work out whether there's a better method for you.
More
Yeah,
reliable
yeah.
method.
Yeah.
So are you able to get morning after pill in pharmacies in Malaysia?
Yep, you can get
Like
it.
over the counter?
Yep. And the thing about morning after pill is, which is a lot of people don't realize, is that if it's too close to your ovulation date, or if you've already ovulated, there's nothing they can do. It doesn't work. So that's why the morning after pill is not 100%.
It's not 100% effective.
No.
So, okay, for those girlies out there who accidentally, just so happened ovulation day they had unprotected sex, what's the best course for them?
So there are three types of emergency contraception. There are two which are oral tablets, and they don't tend to work so well once you've ovulated, okay? The third method actually works very well, but you need to go and see a gynecologist, and that is the copper coil. You can use it sort of, beyond 5 days after sexual intercourse as well, although the earlier you put it in, the better, okay? So what normally happens is that we'll put in the speculum as if we're going to do a pap smear, and then we put in the copper IUD inside. It can be a bit uncomfortable when we put it in, and if it is uncomfortable, you might need a little bit of painkillers or sedation sometimes in certain patients. But the copper IUCD will sit inside the uterus.
How does it look like?
So it's like a T shape, and it sits inside your uterus, and there's copper around the actual body of the IUCD. And what happens is that the copper will actually start to release small amounts of copper into the uterine cavity, which is toxic to sperm, so it kills all the sperm as soon as it comes in, and it's toxic to the embryo, So, and it's also obviously physically something there to prevent implantation.
So I think it's very highly effective, right? If I
Is it
recall.
reversible?
It is. As soon as we pull it out, your fertility comes back. However, number one is acceptability lah. Not everyone can accept having an IUD inside. I don't know. There are some people who just don't like the thought of something being put in.
And someone's like metal, right?
Yeah. So some people don't like that, and because it's a copper IUD, sometimes some people feel that their periods are a little bit heavier when they're on it.
Wait, you still get period
You still get periods.
Oh,
Just that your periods sometimes can be a little bit heavier.
I see. So for like birth control pills, you don't get period. You do?
Yeah.
So I sound so uneducated.
It's okay. That's the whole reason why we are having this
Yeah,
conversation.
because actually, because it's such a taboo topic, right? That nobody talks about it.
I know, I don't know who to talk to, so I'm so glad I'm having this conversation with you. So you get period?
Yeah. So basically, what happens with birth control pills is you take it for 3 weeks, and then normally you will rest for 1 week after that, and in that week you will have a period. So apart from condoms, the birth control pill and the morning after pill, I think these are the only methods that are available through the pharmacy. But like I said, sometimes it's very difficult to go to a pharmacy, queue up with a whole bunch of uncles and aunties who are there to go and check their blood pressure and, who are also listening in on your conversation. So it's sometimes a bit embarrassing for you to go and do that. So one of the ways that a lot of my patients go and get the birth control is actually they use an online platform. And this online platform is actually called Dear Kyra. And this is actually a really good platform that you can anonymously go. Obviously, it's still, to go and buy your birth control and they can send it to you.
So basically, Dear Kara is a telehealth platform where, our goal is to make sexual and reproductive healthcare so it's more accessible in Malaysia. So of course, we allow people to come here to get the birth control online without the need to actually show their face. The feeling of going to the pharmacy, even for a guy to pick up condom is very embarrassed. So let alone for a woman to get pills, right? So we do exactly the same. We ask the same question in the pharmacy, but only thing is we do it online. We set a questionnaire where you can do at the comfort of your home and then get the pills delivered straight to your doorstep.
So it's like a questionnaire form.
Yep, and also, but anonymously.
Do I have a live chat?
Yeah, of course.
Also live chat plus questionnaire.
Correct, and you can get it within half an hour.
At my doorstep?
Exactly.
You can even find out more about, let's say you're not sure about the pill. They have actually got resources on there as well, which helps, clear any myths that you might have or any, sort of worries that you might have. You can actually ask them as well.
Usually for my case, they always worried about, if I take the pill, I cannot get pregnant anymore. I think this is something that I get a lot.
I think, that's
So maybe, Dr. Law, you want to highlight about this part.
So, actually, like I said before, the pill only lasts a short time. That's why you take it every day, okay? So actually, once you stop the pill, your fertility comes back to normal. It doesn't affect future fertility. It doesn't affect miscarriage rates. It doesn't affect future pregnancies.
Listen to Dr. Law.
Yeah.
Okay?
So I've actually got some patients who
verified.
didn't know they were pregnant, and then they took the pill, and then they panic. They come and see me. Oh my God, I was taking the pill, and now I found out I'm pregnant already, and they worried because they're worried that the hormones that they took has affected the baby. It doesn't affect the baby. But obviously stop it, don't continue taking it. But the pill that they took for that short period of time doesn't affect the baby in any way.
Okay, so I guess this also kind of like debunks a lot of the myth, right, associated with birth control, where there's a lot of like guilt given to women. Like, let's just say it's very hard for you to conceive a baby, and there's a lot of just like guilt shaming that most probably because you took birth control pills and that's why it affected the pregnancy or like the ability for you to have babies. So it is completely kind of not related, right?
No, it's not related at all. So you can get pregnant. As soon as you stop your birth control pills, you can get pregnant the month after. And I have a few patients who do that actually. They stop the pill and then they get pregnant like the first month or 1 or 2 months later. Sometimes with a rebound effect, they somehow release 2 eggs because the ovaries suddenly got a bit excited and they have twins. For me, I am a big believer of contraception. I believe that we should, as girls or as women, we should have pregnancy on our own terms.
Ooh, that is
I
empowering
think it's
right
important,
there.
right? I mean, contraception has changed the way we women deal with work. This has changed the way we women deal with life. Okay? So last time, people used to work, and then suddenly, got pregnant. Sorry, that's it. That's the end of your career.
Surprise pregnancy. Yeah.
So now, I really believe that we should have pregnancy on our own terms. When I say you're going to have pregnancy at your own terms, it also means that, when you do want to get pregnant, you should be able, we should make sure that you explore your fertility options so you can get pregnant.
Okay, wow, I learned so much. All right, let's talk about male birth control methods as well. Specifically, vasectomy. What exactly is this and how does it work?
So what happens is that in the male, the testicles are what produces the sperm, okay? and there's like a tube, a connecting tube that actually connects the testicles to the penis, all right? And in a vasectomy, all they do is actually they make a very small cut at the testicle, and they just tie that tube. They block that tube, okay? That goes from the testicles to the penis, okay? So basically what happens is after a vasectomy, you are still able to ejaculate, you are still able to produce something, like some fluid still comes out like normal, but that fluid will have no sperm.
What fluid is that then if there's no sperm?
So basically what happens is the sperm goes in and then there's actually mixed with seminal fluid, and the seminal fluid is produced actually closer to the actual, near the prostate there. So basically that fluid will come out, but there's just no sperm inside. It is.
Wow, so it means when you ejaculate, it's not just sperm.
Yeah, so it's so some people worry that so it's not just sperm. Inside there's lots of fluids. It's actually very high in vitamin C, and
No wonder they say it's good for face. I don't know. I read the article.
Article. He go with scientific article.
But it's got lots of other things inside inside semen itself. But there are sperm inside, suspended in this fluid. So what happens is that once you had a vasectomy, so some people worry, some men think, after this, does this mean that will I be able to orgasm? Will I be able to ejaculate? Yes, you can. It's just that in that ejaculate, there is no sperm.
And would the color change?
The color shouldn't change, but the color will change depending on what he eats.
Oh,
okay. His diet.
Very interested. I hear, pineapple.
So that's what they say, right? They say that what the man eats or what the woman eats also will change how the fluids, that you release taste.
Are there any foods that you would recommend as a gynae?
Obviously, pad thai will not have a good effect, okay? But of course, smokers, people who drink a lot of alcohol, people who drink a lot of caffeine, that can change the color and the consistency and possibly the taste of the semen as well. Technically, it should be sort of like it's like a pearly white.
Pearly white.
That's how we would describe it.
Their fluid has like a different color and smell to it, right? Should they go and see like a doctor? Like, is this something concerning?
If there's a very foul smell, if there's a drastic change in color, if there's any evidence of blood, then yes, please go and see a doctor. That's not normal.
Why would they have blood usually?
It could be infection, but it could be something else that's going on inside. So that's best seen by a urologist, okay? So gynecologists, we deal with women. Please don't come to me with sperm problems. That one a bit. So go and see a urologist.
So I think there's definitely some cultural stigma around vasectomies as well, right? Like, I feel like whenever I talk about vasectomies with my guy friends, you're like, yeah, of course not, like it's a no-go, that there is no room for discussion. What are some of your experience when you have this kind of conversation with your friends?
I think when I first heard about vasectomy, I think a lot of guys maybe, of course, they don't want to cut it because they think it's going to be permanent and then you cannot enjoy. So I think that is why stopping. But I mean, if I'm a guy, I would rather use a better, reliable methods. I mean, why would I want to cut?
Because this is a form of sterilization, right? So, okay, with any sterilization method, there's always a risk of failure, okay? So there's no 100% in life, right? Female sterilization, where we tie your tubes, that has a failure rate of 1 in 200. It's quite low, to be honest. It's still 0.5%. It's still 0.5%. It's still low, but, it is there. With male sterilization, a vasectomy, the failure rate is 1 in 2,000. So actually, that is one of the best forms of birth control. However, it is permanent. So once you've done it, even if you later on decide that you want to have children, you connect the tubes back, the sperm may not work anymore because your body forms antibodies against that sperm. So if people are going to do it, then I would tell them that that is something that you need to think about. Make sure that you don't suddenly change your mind, 2 years later that you want to have another child. I think it's great if you're in a committed relationship and you really know that you don't want any more children. Okay, so I do know some men who do that.
Oh.
So they will say, I'd rather do this than get my wife to take, different types of birth.
That's a man right there.
So I really respect those men, yeah.
We have been talking a lot about what females should be doing as well. I think it's also equally important that we involve the men in this kind of discussion and decisions, as it is a shared responsibility.
I think when it comes to sexual health, it's always both responsibility. I know as a man, of course, you support your girlfriend lah. I mean, you like sex, but at the same time, you also want to protect one another. And I think you can also contribute, like supporting her, paying for the birth control pills. If you don't want to go until like vasectomy, at least lah, you do something like supporting her in buying the pills, or perhaps even initiate the conversation. Because let's be honest, I mean, a lot of guys may not like to use condom, right? Let's just say that a lot of them don't use it and then they want to look for another methods. You can always bring up the conversation of, hey, would you like to try a more reliable method, such as the birth control pills?
And that's how they fight. You don't want to buy condom, you want me to take pill? No lah. But these are conversations, needed conversations, right? So, doctor, when you see your patients, how often do you see like them with their, the male partner?
So normally, by the time they come to see a gynecologist, they normally come in a pair. And I think it takes, it takes a lot of bravery, I think, especially for young girls, to make the effort to come and see a gynecologist, because it's quite scary. And you're doing this probably without the knowledge of your parents, and wondering whether the doctor's going to judge you. So your doctor shouldn't judge you, all right? Whatever conversation you have with your doctor is private and confidential. And I think that's something that all girls need to remember. Okay, so even if you come and tell me that you're having sex and that you want birth control, and your parents come to my clinic and bang table and say, I don't care, you tell me about my daughter, I cannot tell them. I am legally bound by confidentiality. So there's no, so what I'm trying to tell you is that your conversation with your gynecologist or with your doctor is actually a safe place, all right, number one. I think that it's important for you to have the discussion as a girl with your partner. And I think that although it's very embarrassing to talk about sex, it's also very embarrassing to talk about birth control. But I think it's a conversation that we should have. At the end of it, I always believe that, this is a shared responsibility. And you should have sex when you feel ready, if you feel ready. That's very important. So I did say last time once, I said, sometimes girls feel like they feel not obligated but they feel like, oh, he's already bought me dinner, he's already done everything, and then he's already expecting to sleep with me. And actually, if you ask me, I personally feel that if you're not ready, even if you're fully unclothed, it doesn't matter. You should be in a safe enough place to say, no, I'm not ready. I think I'm not ready for this. And he should respect that. And if he doesn't respect that, then honestly speaking, it's not worth it. Because it should be on your own terms.
I think no means no.
Yes.
Like, respect her decision rather than trying to coerce her or try to maybe create the mood again or whatever. I think deep down she knows that she's not ready for it. That's why she would say no.
Yeah. Sometimes a lot of girls that you speak to, when you ask them about their first time, probably a large proportion of them will tell you that they felt pressured into doing it. And actually they were not really ready, but they felt pressured. And so what I hope is that I hope that women should feel empowered enough to turn around and just say, no, sorry, it's not the right time. It's not right for me, And I hope that, that if they found the right person, that he will actually respect that and say, okay, I respect that. We can revisit this another time when you're ready.
So far, the conversations, I've realized the pattern is that there is just so much the onus and responsibility and burden just
falls on
females. And so far for male, it's only vasectomy, which is like a male, and condoms, right? So perhaps, doctor, could you just also share why, the culture and social norms that in the medical field right now is just so skewed towards female?
I think that it's not that it's skewed towards females because the woman needs to take the responsibility. I think it's because they've worked out how to manipulate the hormones for women. I know it sounds crazy, right? So what happens is they've worked out how to actually manipulate the hormones so that you don't ovulate, but yet not compromise your health. You see, for men, right, if we were to give them something, okay, to stop them from producing sperm, actually that could potentially also affect the testosterone levels in their body, and it could potentially affect them. So I think that the reason why a lot of birth control has been directed towards women up till now is because they've realized that it's quite easy to manipulate our hormones to actually safely stop us from ovulation. and be effective birth control. I think that's the main reason.
Dr. Loh, so what do you think are the barriers when it comes to, getting contraception in Malaysia?
So there are a few things that I think we need to consider when it comes to contraception. One obviously is accessibility lah. And now we've already talked about the different platforms at which we can get contraception. So, like we said, pharmacy, there's online platforms now, there's your doctor. So again, like I've said before, if you find that a particular doctor or pharmacist is not actually respecting you and understanding why you need birth control, or they're giving you grief about it, change pharmacist, change doctor, and if in doubt, if you're really still embarrassed about it, consider the online platforms, okay? The other thing that we should consider is possibly sort of the patient's beliefs, their own beliefs. And this is something that's shaped by a lot of things, education, religion. It's shaped by, their upbringing as well. And I think that these are things that will be different for each and every person. What is important is that as a doctor, we have to respect our patients' beliefs, okay? And if they are really against a particular form of contraception, then we can explore. My job is not to tell you what contraception to use. My job is to actually tell you, these are your options, these are the pros and these are the cons, and these are probably more suitable for you because of your fertility wishes. However, the decision is yours. And that should be the conversation that you have.
It's always about kind of like raising awareness, sharing knowledge, and ultimately it is your choice to make it. I don't think it is kind of fair, right, for you to withhold information or not let another person do an informed decision. So I think we had such a fruitful conversation with you, Dr. Loh. Thank you so much for joining us today.
I also want to give a shout out to Bayer for also making this a dream to reality, where we had this podcast where we educate women and men about sexual health, empowerment, and mindfulness.
Thank you very much for having me. It has been a real pleasure chatting about this, and I really do hope that we can empower our girls. Our girls out there, remember, have sex on your terms, have pregnancies at your terms.
Wow, I feel so inspired and empowered. Thanks for listening. We hope you enjoyed today's episode. If you do, be sure to follow our social media and stay tuned for our new episode. Bye.